Hello everyone. In this lesson, we're covering Chapter 6, Nursing Process in Mental Health from Mental Health Nursing. We'll walk through the nursing process as it applies to mental health care, including the role of the LPN, LVN, interviewing, assessment tools, interventions, evaluation, and teaching. Slide 2, Learning Outcomes. In this chapter, we will 1. Define the role of the LPN, LVN in the 5 steps of the nursing process. 2. Identify the components of a mental health status assessment. 3. State the need for the nursing process in mental health issues. 4. State the concepts of patient interviewing. 5. Prepare a patient interview. 6. Collaborate in creating a nursing process for a given hypothetical patient. 7. State the concepts of patient teaching. 8. Prepare and implement a teaching exercise. By the end of this lesson, you should feel comfortable explaining how ADPIE supports structured mental health care. Slide 3, the nursing process. The nursing process is a tool. It is Nareitai, used by all nurses to care for their patients, used to determine priority in providing care, and used to provide care in a systematic manner. In mental health nursing, this structure is especially important because symptoms, behavior, communication, and safety needs can change quickly. ADPI helps us stay organized and intentional. Slide 4, the nursing process, continued. A few important reminders. All nursing personnel need to be aware of their state's nursing practice standards and apply the nursing process accordingly. The nursing process is utilized for all nursing care, including mental health care. The registered nurse is responsible for the initial assessment, meaning the major data collection, and the LPN, LVN can assist in this process. The registered nurse is responsible for the nursing diagnosis. So even when the RN holds the primary responsibility for certain steps, LPNs and LVNs play an active role in supporting assessment, reporting, implementation, and documentation. Slide 5, patient interviewing. Patient interviewing is one of the most important skills in mental health nursing. The intake or admission interview is a primary method of data collection, usually done on a facility-generated form, and questions are often closed-ended. However, if a patient has difficulty answering closed-ended questions, it may help to shift to an open-ended format. Another type of interview is the helping interview, which is used to determine or isolate a particular concern of the patient. This can help identify the main problem, clarify patient needs, and support planning. Slide 12, assessment, mental status exam, ADPIE components. On assessment is data collection. Prepared LPNs, LVNs will collect data about the patient's physical, mental, and emotional health at every interaction. Information is both subjective and objective. Report and document according to your Nurse Practice Act and agency policy. The mental status exam is an assessment tool usually done by the RN, social worker, or mental health professional. Areas assessed include appearance and behavior, awareness and orientation, thinking and content of thought, mood and affect, speech and ability to communicate, memory, judgment, perception, and finally, the nursing process components. ADPI, assessment, collect patient data to assist the nurse in providing care and meeting patient needs. Nursing diagnosis relates to assessment data and determines how the nurse will plan care. Often uses the PES model, problem, etiology, signs, and symptoms. Planning plans patient outcomes with short and long-term goals. Goals should be measurable, realistic, achievable, and have target dates. Implementation intervention defines what actions the nurse or healthcare provider will do and includes a rationale for each treatment. Evaluation determines whether the plan and interventions produce the expected outcome and whether interventions should be continued, changed, or terminated. Slide 6, Guidelines for Nurse-Patient Interviewing. Here are 5 key guidelines. 1, be honest. Tell the patient the purpose of the interview. 2, be assertive. If the interview is mandatory, explain that it's needed to provide proper care. 3, be sensitive. Assure the patient you understand their concerns. Remember, their information becomes part of the medical record. Observe your patient and be aware of body language and tone. Do not impose your beliefs on the patient. 4, use empathy. Let the patient know you're interested and there to help. Acknowledge feelings, but do not judge. 5, use open-ended questions. Personalize questions as much as possible. In mental health care, how we communicate builds trust and improves accuracy of assessment. Slide 11, Nursing Diagnosis. Planning. This slide highlights scope and structure. In most states, the RN determines the appropriate nursing diagnosis, and the LPN/LVN can assist. The nursing diagnosis is typically a 2 or 3-part statement that identifies the patient's needs. Then, planning. The LPN/LVN serves as a partner in planning care collaboratively with the RN and the patient. The patient should be included in planning. Sometimes family can also be involved at the patient's request. Keeping the patient involved improves mental outlook and can support recovery. Planning care includes short-term and long-term goals that should be realistic and measurable in time. So diagnosis guides planning, and planning guides interventions. Slide 7, Implementations, Interventions. Now let's talk about implementation, also called interventions. LPNs, LVNs will be active in assisting patients with the interventions chosen and reporting the success of those interventions. Patient teaching is often a big part of helping patients learn new behaviors that lead to healing and a healthier mental outlook. A caution: some states will not allow the LPN, LVN to teach, so always practice according to your state's regulations and facility policy. Along with every intervention or implementation, the nurse should provide a rationale, meaning why that intervention supports the patient's goal or outcome. Implementation is where planning becomes action. Slide 8, Evaluating Interventions. Evaluation helps determine whether care is working. Evaluating is a form of assessment and may not be allowed in the LVN/ILPN scope of practice, depending on state regulations. However, all nurses are responsible for collecting data on interventions and reporting them according to Nurse Practice Acts and facility policies. So even if an LPN/LVN is not making the final evaluation decision, they play a major role by observing patient response and communicating results. Slide 9, Principles of Learning. Now let's shift to learning. Principles of learning include: each person learns differently and at their own pace. Learning is best if information is meaningful. Learning is best when information is presented in small, workable segments. And success breeds success. Give positive reinforcement for even the smallest attempt at learning. In mental health care, learning often means building coping skills, understanding symptoms, and strengthening healthy routines. Principles of teaching include: know your patient's language, ability, and prior knowledge. Know the material well enough to adapt it to the learner's needs. Have a plan. Good teaching is similar to a good nursing care plan. Be flexible as time allows. Allow time for questions because patients may be embarrassed to ask in a group. Teaching is most effective when it's individualized, supportive, and paced appropriately.